Did you know about the surprising side effects and health risks of eating potatoes? Potatoes, often referred to as a staple vegetable and a nutrient-dense vegetable, can actually cause a variety of health risks that many are unaware of. Before you eat that comforting bowl of potatoes for dinner, it's important to understand the potential hidden dangers of this seemingly harmless food. Potatoes have a complicated relationship with our health, including solanine poisoning from green or sprouted potatoes, concerns about blood sugar spikes, cancer risks associated with acrylamide in fried potato products, and even weight gain exacerbated by calorie density. This video explores these lesser-known aspects and offers important insights to help you make informed decisions about adding potatoes to your diet. Number 1. Solanine poisoning. Jane, a 45-year-old woman, loved gardening and grew her own potatoes. One summer, he picked many crops that turned a little green. Unaware of the potential danger, he prepared a delicious potato salad for the family. Within hours, they began to experience nausea, vomiting, and dizziness. A trip to the emergency room revealed solanine poisoning. A study published in the journal Food and Chemical Toxicology found that solanine, a glycoalkaloid found in green or sprouted potatoes, can cause gastrointestinal and neurological disorders. Eating green or sprouted potatoes can cause solanine poisoning, which causes severe symptoms. Always make sure your potatoes are fresh and free of green spots or sprouts. Number 2. Glycemic index and blood sugar spikes. Tom, a 50-year-old diabetic, struggled to maintain stable blood sugar levels. She regularly enjoyed potatoes because she believed it was a healthy vegetarian option. But her blood sugar continued to rise, and her doctor advised her to reconsider her diet. According to a study published in the American Journal of Clinical Nutrition, potatoes have a high glycemic index, GI, which can cause blood sugar to rise quickly. For people with diabetes or insulin resistance, the high GI of potatoes can make it difficult to control blood sugar. Choose lower GI options like sweet potatoes or non-starchy vegetables. Third, acrylamide and cancer risk. Sarah loved the crispy golden fries and enjoyed them as a treat every weekend. However, he found some alarming information about acrylamide, a chemical produced when potatoes are fried at high temperatures. Concerned, he decided to dig deeper. The International Agency for Research on Cancer, IARC, classifies acrylamide as a probable human carcinogen. Studies show that high levels of acrylamide in fried potato products may increase the risk of cancer. Regular consumption of fried potatoes can lead to harmful levels of acrylamide, which can increase your risk of cancer. Consider baking or boiling potatoes instead of frying them. Number 4. Weight gain and obesity. Mike, a fitness enthusiast, noticed that his body weight was increasing despite regular exercise. His diet consisted of large portions in various forms: fried, pureed, and fried. She didn't understand why until her nutritionist pointed out the calorie density of potatoes. A study published in the New England Journal of Medicine linked higher consumption of potatoes to weight gain over 20 years. Potatoes can contribute to weight gain due to their high calorie content, especially if they are made with fat. Moderation is key, and choosing healthier cooking methods will help you manage your weight. Number 5. Lectins and indigestion. Lisa suffered from recurring bloating and indigestion. He followed a healthy diet, including plenty of potatoes. After consulting a gastroenterologist, he learned about lectins, a potato protein that can cause digestive problems. A study published in the Journal of Nutrition shows that lectins can interfere with the absorption of nutrients and cause gastrointestinal upset in some people. If you have digestive problems, potatoes may be the culprit due to their lectin content. Reducing the amount of potatoes you eat or making sure they are well cooked can help alleviate these symptoms. Number 6. Night force sensitivity and autoimmune reactions. Arthritis. John's joint pain worsened after a meal containing potatoes. After researching, she discovered that she may be sensitive to nightshade, including potatoes, which can make the inflammation worse. An article published in the journal Autoimmunity Reviews discusses how some people with autoimmune diseases may react negatively to nightshades, causing increased inflammation and symptoms. For those with autoimmune diseases, potatoes can trigger inflammation because they are classified as nightshade vegetables. Identifying and avoiding these triggers can improve symptoms. 7. Pesticide residues. Emily, a mother of 2, was concerned about possible pesticide residues in her family's produce. Potatoes, being a root crop, are particularly sensitive to the absorption of pesticides from the soil. The Environmental Working Group, EWG, reports that potatoes often contain more pesticide residues than other vegetables, even after washing and peeling. To minimize exposure to pesticides, consider buying organic potatoes or thoroughly washing and peeling conventional potatoes before use. Number 8. FODMAPs and IBS. Diagnosed with irritable bowel syndrome, IBS, Rachel's symptoms worsened after eating certain foods. Her nutritionist explained that potatoes are high in FODMAPs, which can make IBS symptoms worse. A study published in the Journal of Gastroenterology and Hepatology suggests that foods high in FODMAPs, such as potatoes, may trigger symptoms in IBS patients. For IBS patients, reducing FODMAP-containing foods, including potatoes, can help manage symptoms and improve quality of life. Number 9. Excess potassium for kidney disease. George, who had chronic kidney disease, was advised to carefully monitor his potassium intake. He loved potatoes, but did not realize that their high potassium content could be dangerous for his condition. The National Kidney Foundation emphasizes the importance of limiting potassium-rich foods, such as potatoes, to prevent hyperkalemia. For people with kidney disease, the high potassium content of potatoes can pose serious health risks. It is important to monitor potassium intake under medical supervision. Number 10. Hidden calories in potato foods. Anna liked potato dishes like gratins and casseroles, seeing them as a hearty and healthy alternative. However, she was unaware of the hidden calories and fat often added to these foods. A study published in the Journal of the Academy of Nutrition and Dietetics found that many potato foods are high in fat and calories, contributing to excess calorie consumption. Be aware of the hidden calories in potato foods that can contribute to weight gain and other health problems. Choose a simple, minimally processed preparation to keep your diet healthy. Now I will show you how to eat potatoes the right way to avoid the problems associated with them and get only the benefits of this wonderful food. Without this information, there would be no point in watching the video so far, so pay attention to it. Potato is a versatile and widely consumed vegetable, but it comes with various health problems. In addition to the points covered, it is important to understand how preparation methods, portion sizes, and individual health conditions affect the overall effect of potatoes on your diet. Production methods. The way a potato is prepared can have a major impact on its health effects. Boiling or baking potatoes preserves more nutrients and reduces the formation of harmful compounds such as acrylamide. On the other hand, frying potatoes increases their calorie content and the potential for harmful chemicals. Portion control. Moderation is key when it comes to potato consumption. Eating too much of any food can cause health problems, and potatoes are no exception. Controlling portions and balancing your diet with a variety of other vegetables can help maintain a healthy diet. Individual health considerations. Everyone's body reacts to food differently, and individual health conditions can determine how potatoes affect you. A consultation with a health professional or nutritionist can provide personalized advice tailored to your specific health needs. While potatoes can be a nutritious part of your diet, it is important to be aware of the potential risks associated with their consumption. In addition to the well-known benefits, such as a high content of potassium and vitamin C, potatoes also have several aspects that can have a negative effect on health. For example, solanine poisoning in green or sprouted potatoes can cause severe gastrointestinal and neurological symptoms, so potatoes must be carefully inspected and prepared before use. In addition, The high glycemic index of potatoes can cause rapid spikes in blood sugar levels, which can be problematic for people who manage conditions such as diabetes or insulin resistance. Understanding how different cooking methods affect the glycemic index, boiling or frying versus frying, can help reduce these risks. In addition, the presence of the potential carcinogen acrylamide, which is formed when potatoes are cooked at high temperatures, raises concerns about the cancer risks associated with repeated consumption of fried potato products. By choosing healthier cooking options, such as baking or steaming, you can greatly reduce your exposure to acrylamide and other harmful compounds. Weight management is another consideration, as potatoes can promote weight gain due to their calorie density, especially when prepared with fats and oils. Practicing portion control and choosing simpler foods can help maintain a balanced diet. Also, lectins in potatoes can worsen symptoms in people with digestive problems or autoimmune diseases. Understanding these interactions and possibly reducing potato consumption or choosing alternatives can improve digestion and overall well-being. Finally, pesticide residues in conventionally grown potatoes emphasize the importance of thorough washing and peeling or choosing organic varieties to minimize exposure. Always consider how potatoes are prepared and consumed based on your personal health profile. A consultation with a health professional or registered dietitian can provide personalized guidance on how to incorporate potatoes into a balanced diet that supports your overall health goals. Stay informed about the potential risks and benefits of potato consumption so you can make informed food choices that prioritize your long-term health and well-being. By understanding these nuances, you can enjoy potatoes responsibly as part of a varied and nutritious diet.